the, I think, last YouTube live. In fact, I had a few questions where I think I've answered in response to that. The questions were very similar. Now, one more question in relation to, I took the seminar on cancer and homeopathy, where I had prescribed Belisper to a case of cancer of blood vessels. So you can go and read Belisper and repertory where you can get the answer. If you can't, then I will basically try to explain how did I go to that remedy. So now there is a lot of cold wave in Nagpur and cold wave everywhere, and people are suffering from cough, cold, and coryza. So automatically, you must understand, if the patient comes to you with a lot of cough because of exposure to cold air or any other cause related to cold air, going out in the party, going out in while traveling, while at home, there is a lot of cold air everywhere. So in India, especially in Nagpur, there is a lot of cold air, and if you get these type of conditions in your case, in your place where there is aggravation from cold air, or the patient has went to a cold atmosphere and he has got cough, cold, and coryza, the cough is very, very severe, and the patient says that he keeps coughing, and there is no change. So I would just, of course, there are a lot of remedies, but just few remedies which I have found very useful, which are not there in the Mathemedica in 3 letters in that red mark, but then still that has given me very, very good results. The first remedy which I have used in this type of cough, which is too much cough, the patient is irritated because of the cough, because of cold air, I have prescribed the patient Corallium rubrum. Corallium rubrum has given me so many results, where I have found that remedies like Rumex and Causticum and Allium cepa or Cuprum metallicum have not given me results in this type of cold weather. So make sure that you make a note in your Mathemedica, Corallium rubrum. Many of times it happens that our remedy which are frequently indicated, like I said, Allium cepa, arsenic, Causticum, Rumex, Hiparsulf, they don't give results as the infrequently used medicine give results, like Corallium rubrum. Corallium rubrum have given me results in so many cases where I failed with the so-called frequently used medicines. Hello, Dr. Barbal. Good afternoon, Dr. Devangi. Yeah, so that's so in relation to cancer, there was a question of how Belisper worked. That basically one of my assistant had put that clip in the YouTube or in the Instagram, just half part of that, where I was treating case of cancer. I was taking cancer in Batra's Academy lecture. So it was Belisper which I prescribed to the patient after lot of remedies which failed, and that worked. So that basically, if you see, that was a case of angiosarcoma. That was a case of angiosarcoma. It's a very rare and a very aggressive cancer that starts in the endothelial cell, that is the walls of the blood vessels or the lymphatic vessels. So in that case, Belisper I prescribed the patient. The patient responded very well to the treatment, and with that treatment, he survived for at least 3 years after Belisper. So I'm explaining a case of cancer where the whole case taking was done, remedies were prescribed, but it did not work. Just by one symptom, that the cancer of blood vessels, was an angiosarcoma, and that reacted very well to Belisper. That was the whole length, but it was shot as a, in today's we have social media, Insta reels or YouTube reels. That's why it was a bit confusing, Dr. Babel. If I could answer the angiosarcoma. So one more question we have. Keep asking questions so that male 74 years, diabetic, CRF, creatine 4, very mild, obedient, follow strict routines, and no anxiety for future further of dialysis in future, please advise. So interesting case, a case of chronic renal failure, creatine count 4. See, if the patient is routinous, if the patient is strict, the nature of the patient is since birth. What are the changes which the patient suffered from after he suffered from chronic renal failure? That is more important, and rather than taking the symptom which was there before. Because if the patient is suffering from either kidney failure or diabetes or BP or any cancer, for example, and if you prescribe on the same nature that was present in Sora, then you'll always get the same remedy. What Hahnemann says, what is the change state after the disease, that you have to restore to health. If you understand what I mean to tell you. Otherwise, you can take the patient, that the patient, this patient, if it comes to me, you can take the rubric traditional, the patient traditional. So in that way, you see, if you say the patient traditional periodized, the rubric is periodized, you can take a lot of remedies. You can go to that rubric. If you have the repertory in front of you, you have calcareca, we have lachesis, you have lycopodium. I think veratrum is the arsenic is also there. But my suggestion to you would be, you take the rubric, you take the change state of the patient, and then if you prescribe, you'll get better results rather than prescribe you on what was there before. That will be there for life. That is important for us. I hope you understand, Dr. Joshi. Yeah, Alexandra, hello. After a long time, stiffness and pain in joints increase in winter, mobility is reduced. Yeah, Dr. Nitin, this was a question asked by you before also. I think you can go to the previous YouTube, but still, if you want, you can think about guaiacum, macphos, aristolochia, formica rufa, lot of medicines. Creatine question. Yeah, so this was the answer to the question. So let us go forward. So if you are prescribing on that only, see, if a person is traditional, if the person is periodized, before also, now also, and for life also, don't keep on repeating the same rubrics and taking the same rubric. Otherwise, you land up in the same remedy. Always see in case taking. That was the case taking which I was teaching in Batra's Academy for cancer. I am a mentor for that cancer course. So I was taking that lecture on cancer, and I tried to tell them how to take rubrics, take symptom from the books of medicine, how to take the symptom. Every time you take the whole case, you try to interpretation can be wrong. But when the body speaks, that cannot be wrong. So try to interpret from the disease state, from the book of medicine. Try to understand how is the cell speaking in front of you, and that's how you can get the remedy right. Okay. Good afternoon, Dr. Disha. Yeah, so I hope if you feel the answer is okay and you are satisfied with the answer, do give me some thumbs up, or whether you understood, so that I know that and I can go forward. For example, if a person is working day and night, if the person is working day and night, intellectual, a homeopath doctor like us, or a chartered accountant, or a lawyer, he would suffer from frustration of mind. No, he's tired because of working. If you take that rubric for that personality, this would be quite normal. Just tell the patient to take a break for 3 or 4 days, go out and come back, he'll feel better. So don't unnecessarily waste your medicine. Our medicine are very, they are like gold. When you prescribe the medicine, make sure that you have the right prescription, the right symptom, and right rubrics and right symptoms you have taken for prescription. Don't waste your prescription. Okay, so let us go forward. If there are no questions, I can take few other things which are important in this state of cough and cold. Now, a lot of people will come to you in this state because there is a cold wave in India and in Nagpur also. Sir, patient age 50 years, erosive gastritis, having excessive dryness of mouth, that tongue sticks, red bright tongue, feeling of heat in epigastrum region, and few minutes of food, wants house neat. Okay, so in this case, first of all, try to find out the syphilitic symptom in this case if you have it. In your case, there is a very important symptom. The tongue is so dry that it sticks to the mouth. Whenever, if this patient comes to me on the first instance, what I would give is, I think, with other symptoms like nux moscata, that everybody would think about nux moscata. There is a lot of dryness, and ask the patient whether the patient is thirsty or thirstless. This is a very important symptom. You must ask if the patient has a lot of dryness of mouth. If it's diabetic, then don't take that symptom. If it is not diabetic and the patient is has very dryness of mouth, ask him whether he's thirsty or he's thirstless. If the patient is thirstless with dryness of mouth, that becomes very important. And the first remedy is Nux moscata, second is pulsatilla, third is bryonia. But if the dryness is with thirst, then the first remedy becomes bryonia, second remedy becomes natrum mur, and third remedy becomes phosphorus. I hope you understood that, Dr. Navjot. Sir, after consulting you, my period was given thoroughly. It helped to get the periods. Very nice, Dr. Desha, and thank you so much for and thank you so much for at least telling that whatever we have discussed in this YouTube live, it has worked for you and it is working in your practice. The main aim of mine is that it should help in your practice to grow in your practice. Okay, that is so. Thank you for sharing that. I think Navjot keeps sharing, and thank you, Dr. Disha, for sharing. I want to discuss the whole case with you on WhatsApp. I have given Nux moscata. Yeah, Nux moscata, that's why. Nux moscata is basically the basic remedy, the first remedy that everybody thinks about. Thirstless but drinks sips. Yeah, that is important. So it is with thirstless, then Nux moscata was right. But normally, Nux moscata is given every time we have thirstlessness and dry mouth. But in Nux moscata, one symptom is also important. The patient is very drowsy and very sleepy. That I forgot to add, So think about pulsatilla, tuberculinum, cocculus is also there. I think camphor is also there. You can think about, you can give the case and we can discuss the case. Okay. In the meanwhile, you can take the thyroid report of your mother and we'll see that the thyroid comes down, Dr. Navjot. Okay. So let us go forward. Now, dryness of mouth, we have to understand first what question to ask for what symptom. That is important. If the patient is telling you dryness of mouth, then ask for thirst, and second thing, ask for salivation. Dryness of mouth and the patient has saliva, and just because of salivation the patient feels better. This is a very important symptom. I have solved cases of gastric ulcer, duodenal ulcer by this only one symptom. And the remedy, you will be surprised, I gave the remedy the patient aconite napellus. Remember, dryness of mouth and salivation ameliorates. Please think about aconite napellus. Very important. And just to add one thing, I had a case of what Dr. Disha told. I had a case of menses problem. The patient was, suffering from menses problem, irregular bleeding. There was no time of bleeding, sometimes early, sometimes late, no time. I gave the patient a lot of remedies, and for 6 to 8 months, the patient was not responding well to the treatment. I asked the patient what happens when there is menses. The patient told me there is a dryness of mouth during menses. Just adding 1 or 2 symptoms, I prescribed the patient Cedron. Believe me, Cedron. And Cedron cured that case. Just Cedron 30 single dose. I did not repeat for 2 months, then Cedron 200. And now the patient is in follow-up for the past 1 year. Menses are absolutely on time. So there's one symptom of dryness of mouth, important what to ask. That is important. Okay. If you understood, let us go forward with some question. The same patient now has TSH 5 points, so maybe thyroid worked. Should this be considered to be treated for? Disha, first of all, it is not important that what was the count, how is the thyroid. If you have given thyroidinum, maybe there was a problem in the thyroid, just a subclinical hypothyroidism, and it worked. So just wait for some time, see how the menses comes for next 1 or 2 months. Again, repeat that test of thyroid and see how does the TSH improve. If not, then we can think of something else. But this time, just wait for some time. Okay. Let us go forward. I think belly spur, somebody asked the question. I hope that is taken care of. Belly spur. These cases, teach belly spur case of angiosarcoma. I always say that you have to be lucky to get this type of case. I had only 2 cases in my lifetime. One case I could not do anything for the case. But in this case, I tried to prescribe through the local symptom. And the patient is much better. So this is something about dryness. See, when a patient comes to you, it is the whole case taking has been done. Then it is very important to understand what to ask. A lot of my assistant doctors are working with me. They say, sir, how did you ask this question? Now, Why did I ask that question is basically depending on the experience I've had in treating cases. Otherwise, what happens? We take the similar rubric sometimes. Traditional, again a rigid personality. Rigidity, again the same personality. Eccentric personality, same rubric. Obstinacy, same part. So we have rigidity, we have traditional, we have obstinate, we have eccentric rubric. If you see, हम बोलते हैं ना in English, somewhat similar everywhere. It is very important to find the hairline difference between the rubrics and then prescribe. So otherwise in repertory, you start taking symptoms, and if you start repertorizing the same rubric, हम बोलते हैं ना मोटा मोटी same similar ones, so you get 3-4 rubrics, but they are very similar to each other. So then you are not able to get the right remedy. You will say that in my repertory chart, I repertorized, I had 5 rubrics, I had only 1 remedy. How did it not work? Because the question framing is very, very important. Why did you take that rubric for prescription? Understand that a rubric, maybe if you take a rubric childish in a person of 70 years, is more important rather than taking the rubric childish in a child of 10 years of age. So it is important at what point of life you are taking that rubric for the patient. If you are taking a case of a doctor who has been practicing for 30 years and he says, okay, I am so tired of practice, I just want a break, don't take the rubric prostration of mind, because that is quite normal. So it is important at what time, at what part of life you have taken that rubric for repertorization. Hello, are you with me? Yes, are you with me? Are you understanding? Remember the case of pediatrician having lymphadenopathy, his reports are better, but he has not shared. No issues, no problem. No problem, Navjot, but nice that you are getting good results with that. If you feel the patient is right, we are very happy with that case. See, it is not possible every time to keep the reports and keep the record. I think Navjot had come to my clinic and she has seen the amount of patients we are seeing every day, So every time shooting a case is very difficult. But if the reports are good and we believe that the reports are good, so it's a part of belief, if you say it is right, it is right. There's no problem. High cholesterol and triglycerides level. Please take the whole case, Nitin. Can we give something specific to LDH? No, Dr. Disha. You have brought a very beautiful result in case of menstrual problem by prescribing thyroid. We did not prescribe thyroid because of the patient was having thyroid problem. So if you stop prescribing in specifics, you can get results and you cannot get results also. But LDH, if cholesterol is high, LDH would be high. So the patient is suffering from some grief that is keeping inside. So what the patient is keeping inside, ask the patient what is troubling him, what is filling inside the patient, and you can get the remedy. Okay, homeopathy is not difficult also and not easy also. It depends on what approach you're taking. And for me, you follow anybody, but lastly, please follow Hahnemann. If you don't get results from any other approach, go to organ of medicine, go to chronic disease, go to Hahnemann's approach, and you'll get the result. Can you give not taken further follow-up, and even I called him for follow-up. Oh, that's very nice in part of you. I never call for the patients for follow-up. Crohn's disease, ileitis, हाँ मुझे आसान से tips. Crohn's disease, basically autoimmune disorder. We were just discussing a case. If I think the London group who had come to me in my clinic, there was a case which I had got live case of Crohn's disease and amoebic colitis. So I think she will be able to tell you better that we had cured Crohn's disease, not palliated. It is curable. Please, sir, Crohn's hota hai. That's what I'm telling you. I had a live case. I had a live case where I had called that patient, supposed to be my friend's wife and my friend's daughter, and that time I think some doctors from London had come to my clinic and they had seen that patient live, that we had cured Crohn's disease. So it is curable. If you ask me whether it is curable or not, I would always say everything is curable which is curable. You take the whole case, take a good repertorization, good miasmatic schedule of the case, and then the remedy will show. I cannot say miracles, but remedy would show fantastic results in homeopathy. Though it sounds very easy, but case taking is very important. Please share any of a case of bronchitis. Okay. Medicines for cough and cold with mucus, coccus cacti, antimtat, kali sulf, just Arelia racemosa, grindelia. Can sciatica cure without surgery? Yeah, definitely yes, it can be cured without surgery. Please share any of the case of bronchitis. Bronchitis basically, if you're treating case of cough, one step ahead it comes to bronchitis. Simple as that. So just go ahead one step ahead. See how is the patient behaving when he or she has bronchitis, or how is the cough, how is the modality, any defining feature of the patient's personality, or any defining feature of the disease at that time of episode. That's important. For example, a case of bronchitis would tell you, sir, whenever I have cough and bronchitis, there is so much pain in the chest, I have to just widen my chest like this and then I feel better. A very interesting symptom, we have the remedy. Or the patient says that whenever I cough, I have to put my hand on the chest and cough because it hurts. Or the patient says, whenever I have cough, I have pain in my throat and sometimes blood comes out. So these all are symptoms where you have to, see remedy and understand what remedy to prescribe. Okay, Navjot, are you with me? Did you understand? So you can have remedies like Bravia also, phosphorus also, stachynophos also, Calicarb also, simple Rustox also. These are the remedies which have very, very interesting symptoms in the pathology. Guaiacum zirconium QR30. You can give 30. You can give 6 potency or LM potency. It works better. Sir, acidity, it is genetic. The family suffers from hypercholesteremia. No, acidity, it's not. It is, see, the burning. Disha, burning is there in the stomach. So if there is burning, there has to be burning something in the mind. If that is resolved with medicine or with counseling or with any other thing, then it is important. But because the burning is so much that it is not be able to solve by counseling, then homeopathy medicine has to be given. So you ask, where is the burning in the mind? Important is that the gut is called as the second mind. So it has all the basic neurotransmitters, especially serotonin. So ask the patient, where was the burning, where was the mood lost, what are the other symptoms which you can ask. This is how you have to question the patient. The frame of questioning the patient is very, very important. Ask, why is the burning so much? And if you will definitely get the answer, and you'll be surprised that you'll get sometimes some remedy which has no symptoms in its proving or pathology in relation to stomach, and then still it works. That is very. I prescribed a case, of where I had prescribed the patient for burning and acidity terebinthina, which has hardly any symptoms of GI tract burning, but that worked, and that was that cured the case. Okay. Patient having cough, mostly while lying down, pain. Yeah, so you can lying down cough. The first remedy that everybody should think about. In today's lying down cough, very cough, exhaustive cough, painful cough, barking cough, loud cough, pain in the throat, hyoscyamus, causticum, rumex, sanguinaria, and pulsatilla. One of the 5 will work, Dr. Navjot. Sir, there is a book on cataract by Burnett. तो क्या हो उसको कर सकते? No, I have never read the book Cataract by Burnett, and frankly speaking, I don't have so many cases of cataract in my practice. Few sporadic cases, few have responded very well. In fact, last month only I had a case of cataract, and the doctor says he was going to operate that case, but he says now the patient is better, no need for operation. So I have a very little experience of treating cataract in my practice. So I think you can read Burnett and get your queries solved there. Okay, let us go forward. Sir, how to study repertory? Please give me some tips like practical application, not theoretical. See, whatever you have seen in my practice, it is all it is all clinical. It is not important that how many rubrics you take for prescription. It is not important that how good you are in converting the patient's language into rubric form. It is more important that which rubric you have taken for repertorization. Remember my words, everybody. It is not important how many, which rubric you have taken for prescription, whether that rubric defines the whole patient's personality or the disease personality. This is very, very important. There is no law, fixed law, what to take. Of course, you can always tell that you can take the syphilitic miasm and then prescribe, appears to be very theoretical, but which rubric you have to take for prescription depends upon your experience. So I would suggest, if you are a young practitioner, do join some senior practitioners, so that you can brush up the knowledge of repertory, because sometimes it is very difficult to understand how to convert the patient's language into repertory form, because one symptom of a patient can have different repertorization depending on different schools of thought. So one only symptom will have 4 rubrics depending on which school you are following. Very difficult. So it is important sometimes to join a practitioner, and then you can get an insight, because he would be taking rubrics in front of you. You can see his OPD or her OPD, or you can see the results he's getting by taking that rubric. That is my suggestion. Neuromuscular weakness in paralysis, a very vague question. I can't answer that. Sir, in which case of headache can we use medorinum? See, basically medorinum, which case of headache, that's a very, what I can call a very difficult question to answer. I cannot say which symptom to take for prescription. Medorinum basically is a nosode having a very strong psychotic history. So it would be very theoretical to say that psychotic history is very important and please go and just take the psychotic history. If you are prescribing only in case of mind of medorinum, then you can go and just take the symptom of mind, or you can take the symptom of headache and then prescribe. But my suggestion to you would be, if you are not getting any case where you have symptoms of symptoms of headache, you prescribe on the psychotic history. That is very, very important. Otherwise, you just take out the head symptom and prescribe medorinum. So I have never prescribed medorinum only on symptomatic on headache. I will definitely prescribe medorinum on either a constitutional prescription or a psychotic background. Sciatica left side, sometimes both side pain in lumbar sacral region, pain goes down up to knees. Kali carb ammonium more helped, but not cured. Feeling good on sleeping, both feet feels cold. You can think of 3-4 remedies which comes to my mind immediately what you're telling about. One is phytoleca, second is zincum metallicum, third is hypericum, fourth is macphos, fifth is colocynth, and sixth is calcarea carb. Which books are used to study nosode in detail except H.C. Allen, and which book which is best to study miasm in detail? For miasm, I would suggest you to basically read simple book. We have read Organ of Medicine by B.K. Sarkar, and there is no such, I have not read such a book on nosode, though I have a lot of books. But whatever mathematical you are reading from books of either Kent or Allen's or Borick or Boger, read nosode also as a normal remedy. Don't fix that mind that nosode and then you should never start a treatment with nosode, or you can open the case with nosode or intercurrent nosode. Don't have that, whatever I have seen in my practice. Basically read nosode basically as a remedy, and then you will find that it is working good in your cases. Yeah, Dr. Rahul Tiwari, I hope you understood something. If you do understand, just tell me so that I know that you're understanding, and we can just skip on and go to other. Otherwise, I would give you more insight on what to read and what not to read. Yeah. So yes. So we are short of time. We have only 1 minute left. Any other questions? Few questions have been scrolled up. I'm just searching for some questions. Yes, sir. What to case? I hope medorinum question is clear. I have never prescribed medorinum classical symptom for headache. Although the modality of medorinum should be like head down, like we do namaz, that type of position is of medorinum. Salman College, which is 1970 established, sir, we have practice of 35 years. I attended OPD for my now 3 years. Yeah, Dr. Tiwari, it is, what can I say? It is not important that how many years or how many time you have spent. It is the quality time what you have spent with your sir, and how much it has affected your practice or your knowledge in mathematics and treatment. That is very important. Okay. So thank you. It's already half an hour up. Thank you for joining me, and thank you. I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you. Until next Saturday. Goodbye.